Yeah, Dr. Denise Shaver is an assistant professor of history at Oakwood University. She says that this news should serve as a wake-up call for how serious this virus is, but she also worries that fewer people could show up and vote next month.
That's the main thing, is to still encourage people to be able to vote, but do it safely.
Professor Shaver says it's easy to become fearful after a president becomes infected with a potentially fatal virus. She says it's important people still focus on how to vote during this pandemic, whether that's by mail-in ballots, in-person absentee voting, or going in person while social distancing on November 3rd.
People who have these protective measures and access to health, the highest level of health care, can still contract it, then anyone can. And we need to take it seriously and put in the protocols that have been outlined for us.
As far as what could happen if the president becomes too ill to do his job, Shaver says there's an amendment addressing this scenario. The 25th Amendment was put in place back in 1967 in case a president becomes disabled or dies.
It outlines the process of succession for the vice president. And so if the president is living, he would actually have to submit a written declaration of resignation. And if he died suddenly, then the Congress would vote for the vice president to take over.
The president could also temporarily transfer his powers to the vice president, then resume powers of office when he's ready. Right now, out of an abundance of caution, President Trump will spend a few days at a military hospital working from the hospital's presidential suite.
Is in place in case of an emergency like this, but as you said, we're not hoping for anything like that to happen.
Despite working from a hospital, the White House says that the president is able to continue his official duties and remains in charge. Now, as far as Vice President Mike Pence, he has tested negative for coronavirus. Reporting live in Huntsville, Megan Reyna, WAAY 31 News.